a pastor who typically does different events, different press conferences, I always like to start by getting everyone together. So when I say fired up, you say I can't take no more. Fired up! Can't take no more! 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 We are here today, this morning. As I stated, my name is Pastor A.J. Johnson. I'm the pastor of Urban Hope Refuge Church, and I'm a community organizer with the Christian Activities Council. I'm here in solidarity with 1199 nursing home workers who have sent notice that they will be striking on May 1st, 2019. These workers are nurses, CNAs, LPNs, dietary workers, and housekeeping workers. They are the backbone of our healthcare system in Connecticut, and they take care of our mothers, fathers, sisters, and brothers that are residents of nursing homes throughout Connecticut. Much of this workforce are women, and in particular, women of color. I'm going to say it again. In particular, women of color. Immigrants, caregivers, who go home to their own families at the end of the day, tired, during the struggle to provide for their own children. Many work multiple jobs. Some are doing some of the hardest work that some of our legislators in this building will never do. They work very hard for very little pay. Yes, we're going to church. Because I ain't going to go on Sunday. That's all right. Today, they will be telling you why they feel so strongly about the patient care that they deliver, and why they have decided to strike. As a former worker in the human service field, I know what it is to take care of our most vulnerable. I know what it is to do a job that no one else wants to do. I know what it is to change somebody. I know what it is to be in these spaces, to do the work that's the hardest. I know what it is. And so today, these workers will be telling you their stories. These workers do some of the hardest work for some of the lowest wages, and it's not getting easier. As you will hear, residents in nursing homes require more care. They're not little old ladies and men anymore. We see behavioral health residents who require drug and alcohol rehab, and patients that are some of our uncles and cousins, and who are there to work with our seniors who have in their last moments of life. So today, we're not here because we want to be here. We're not here because there's something great happening, but we're here because there is a contract, there is something that needs to be made right and made done. And the folks in this building have the moral obligation to do so. So today, I would like to bring up my good friend, someone who has been in the fight for a very long time, the president of SEIU 1199, President Rob Burrell. Can we please call him?
Brothers, sisters, 1199 warriors, good morning.
Good morning.
I want to say a thank you to some of our elected officials who are here with us. Senator Blumenthal.
Yes.
Senator Kushner. Senator Stout Anwar. Representative Robin Porter. And many others that I'm sure I'm going to miss. Apologies in advance. Senator Mary Abrams. Thank you. Of course, members of the media, and most important of all, to our members, we know that to stand up and to take strike votes is never an easy thing, but we are here for a reason. We were here 4 years ago on Tax Day 2015, and we choose Tax Day as an important day to bring nursing home workers together to fight, which is that it is our state tax dollars. It is our state tax dollars, all of us as Connecticut residents, that actually pay for the services that are done in nursing homes. Our budgets are moral documents, and so we are asking for appropriations that allow us to settle contracts that move workers ahead. We need to raise wages in nursing homes.
Yes.
As Reverend AJ said, most nursing home workers are women. Most nursing home workers are black and brown. And everyone in this room, every caregiver in this room knows what it is to do their work. It is a labor of love. Okay, they give of themselves in caring for the sick, the infirm, the elderly. But you cannot pay the rent with love. You cannot feed or clothe children with love. Workers in this industry have been limited to 1-2% raise, if they have gotten any raise at all. That was in 2018. Our low wages in nursing homes mean that the homes themselves are struggling to recruit and to retain workers. We've taken strike votes. We concluded on Friday, representing 2,500 different nursing home workers in 20 different nursing homes. That was a difficult decision, not one that is done lightly. It was a last resort. And workers voted to strike because there must be change in their conditions. There must be. We're standing up for stable care for our residents. We know that well-paid workers are workers who have the ability to give their residents the very best. Okay? But after no raise in 2016, no raise in 2017, no raise allocated in 2019 or 2020, what we are talking about is at best 25 or 30 cents of raises for the vast majority of workers covered by these nursing homes. That is not enough. Nobody can live on a 25-cent raise over a 5-year period. We refuse to be second-class citizens.
Yes, that's right.
Our strike vote was 1,449 yes to 78 no. It was overwhelming. Our members are united. They are unified. They are organized, and they know what it is to fight. So we are here to ask the legislature. We are here to ask the governor to do what we know is right, which is to allocate funding that will allow for people to have raises. What we're asking for is 4% in increases in 2019, 4% in 2020. That is the state budget. There is no money for higher wages in the current budget. And we should remember that all of that investment, every dollar that the state invests is matched, 50% of it, 50 cents of every dollar comes from the federal government. So really we're talking about half that money, okay? Proper staffing levels need to be allocated so that patients are cared for based on their acuity. So we're also standing up for our residents and making sure that we are fighting to get the legislature to make staffing improvements. There is a bill, Senate Bill 375, which is asking nursing homes to be accountable for staffing numbers that are required and that will allow us to give the best possible care for our caregivers. There's other language in the budget which is also problematic, which would close nursing home beds. When nursing home closures take place in Connecticut, they tend to be in our urban areas. What that means is that people in cities are impacted as they have to go further and further out into the suburbs to see their loved ones if nursing homes in those cities close down. This is happening at the moment that the boomers are aging, and we know that as people get sicker and more infirm, you get to the point where you need 24-hour care in nursing home facilities. Closing nursing home beds at this point in time will be an unwise decision because it will hurt folks who need access to that care, that valuable care. And the problem is only going to get worse as the boomers continue to age. This strike on May 1st is avoidable, but it needs and requires leadership from our government, leadership from the state legislature, and leadership from the administration. Those who believe that healthcare workers deserve dignity, that the elderly deserve the best, need to take a stand and making sure that the budget reflects those commitments. And in that way, we can make sure that we don't have to do what is our last resort, which is to go on strike. But if we get to that point, everyone in this room knows that 1199 is a warrior.
Thank you so much, Brother Rob, for laying it out very clear of what we are asking for. And just for a moment, I just want to allow us just to reflect what this strike could look like if workers truly don't show up to work. You know that sometimes the patients in those beds or the patients in those businesses depend on the work and the excellence that these workers bring. And a strike will only harm those patients that lean and who have built relationships with these folks. As Brother Rob said, this is truly avoidable. And I hope we do the right thing here today. But talking about do the right thing, I just want to applaud some of our legislators that are here in the building. Can we make some noise for Senator Saeed Anwar? Representative Jinga, can we make some noise for Representative Jinga? We have Senator Abrams here with us supporting us today. Senator Abrams, where are you? Senator Kushner. We have Senator Blumenthal here with us as well. I gotta look like that to get a formula. We have Representative Gary Reyes. And Representative Ron Napoli. And last and not least, Representative Matthew Blumenthal is here with us as well. Thank you all for your support. Representative Robin Porter. So now we are going to hear from the most important voice in this room, which is a worker. And I would like to bring to you Miss Corrine Reed. Can we please put our hands together?
Good morning, Pastor A. Johnson, 1199, President Rob, Senior Anwar, and other elected official and members of the mayor, and my fellow co-workers for being here. My name is Corrine Reed. I work at Trinity Hill Healthcare. I have a passion for my job. I respect my residents. They are my family. I spend majority of my time with my residents, more than I spend with my own family. We know everything about our residents. My co-workers and I have voted to approve a strike to defeat our resident quality of care and to demand better wages and benefit immediately. Currently, my nursing home have working conditions that all overburdened, which is hard for them to gain and maintain. Directly like our caregivers, we work real hard in the nursing home. And it's really stressful.
And short.
Yes, and we work short too. As a nursing home workers, we need a fair wages. My current salary is just $15.12. I have been working as a full-time CNA for the past 10 years. I have a second job at Parkville Health Center, where I work 16 to 24 hours per week to provide basic for my family. Since 2015, I received one raise of 27 cents. Listen, the mortgage went up. Everything went up.
Yes.
I know nobody here can go to the supermarket with 27 cents. No. So I want the mayor to consider us and the senator today. They said there is no money in the budget. The last time we checked, there's a fallen co-worker and I face overburden, workload, while caring for the residents, and we require a higher care for the limited resource available. I would just strongly advise our elect officially to do the right decision for nursing home workers, residents, we are stressing out on the job. The job is hard. It's not first time when you go into a nursing home, it was all the older folks. Now it's all young folks. We're facing a lot of challenge, and we need help. The only time we get the help is 5 days for the week, for the year. It's when the state's in the building. So we need you guys to consider it. Just don't listen to us. We need you guys to consider us. Please.
Thank you.
It's funny when you hear that there's no money in the budget. I was raised by a black woman who never really had much, and she found a way to balance pennies to get me to college. And it's funny when we say the state doesn't have any money. Maybe we need some of these women of color up there. How about Robin Porter? All right, we have a friend of our communities that's here, and this young man is serious about what he does, and I know he's serious because on issues that I have personally brought to his feet, he has responded, particularly when it comes to the housing conditions in Hartford. Can we please put our hands together for Senator Richard Blumenthal?
How about a big round of applause for Reverend Johnson? I'm really proud to stand here today, coming from a place that knows less and less justice, our nation's capital. And I say to my colleagues, if you want to see people standing for justice, come here to Hartford and say to 1199, we're ready to fight. We're not going to take it anymore, right? We're not going to take it anymore, and we need better health care in this country. That's where you are fighting for, and I'm so proud to stand with you today. Now, Rob mentioned the aging boomers. I'm one of those boomers. But I'm not aging. I'm ready to fight, and I'm not going to take it anymore. And I'm ready to stand with you. I'm ready to stand with you as long and hard as it takes, because health care is a right in this country. Health care is a right, and we need Medicare for all. We can come to a solution. Now, I just want to make a couple of quick points, and that is, you know, you are fighting not just for yourself, not just for your family, but for those folks who are among our most vulnerable.
Yes.
Most vulnerable, and I say to the people of Connecticut, you have a stake in this fight. Because you'll be there, God willing, someday too.
Yes.
And you'll need care from these folks.
Yes.
And you want them to have the good health and the families supporting them that will enable you to have the care you need and deserve. And it is about a compact. It's a compact between generations. It's not just about one generation, not about yours or mine. It's really about all of us together. Generations of Americans caring for each other, every one of us, race, religion, demographics, income. We all need nursing at some point. And if you want it, support these brave, courageous workers in what they're trying to do. I'm here, and I hope Connecticut will be behind them as well come May 1st. Remember, a strike is always the last resort, right?
Yes.
A strike is always a plea for justice. That's why we're here. We're going to get justice. Thank you all for standing.
Thank you so much, Senator Blumenthal. And I just want to acknowledge another representative that just came in, someone who I've personally been in several fights with. Strike McDonald's, strike Burger King, got arrested, all that good stuff. Representative Edwin Vargas. All right, our last speaker today is someone who's fairly new here, but not new to the medical field. And he is going to come talk about some things that we need to look out for if these workers go on strike. Can we please put our hands together for Senator Anwar, please?
Good morning, everyone.
Good morning.
So while I'm a senator, but I'm a physician as well, and I'll speak to you as a doctor. I know I love my patients, and I love you all because you provide care to all our patients.
Yes.
Every single individual gives their heart to try and take care of the members of the community who are the most vulnerable. I want you to think about this. Now, if you look at the burden on our society from bad choices, this is the data from study after study after study, that when you do not have the appropriate level of staffing in a nursing home, the number of falls increase. The number of hip fractures increase. And 1/3 of the elderly with hip fractures die from the This is a matter of life and death.
Yes.
We also know from study after study that the urinary tract infections increase when there's not enough people. We know that the weight of the individual sitting in the nursing home rehabilitating, they cannot do that because they are not even able to be fed. That's what it's all about. Feeding the people, taking care of them, taking care of their health. We also know from enough data that the hospitalization risks are much higher when you don't have enough staff. So guess what? We are all paying for it, but might as well pay early and prevent all of that. This is all preventable. And for the amount of money that is put in, the results are far better. The ROI, which everybody looks at in this building and around the building and everywhere, the ROI is the highest to take care of the workforce. The best thing that you can do is to have the right workforce, but make sure they're treated with respect and honor, because they're doing honorable work. And here's the responsibility that the state of Connecticut has. The state of Connecticut has a responsibility to increase the Medicaid reimbursement for the nursing homes. Because guess what? If the Medicaid or Medi patients are not being paid for, they cannot take care of their responsibility. But the other group that has to look at this is the nursing home owners. You need to put your money into the right place. If we want a sustainable society where everyone is taken care of, everybody's family members or themselves are going to be provided the best care, this is the room to be in, and this is the room to start from, and make sure that 1199 and all the workers around our state who are taking care of the people who are most vulnerable are protected. So I stand here with you, with my colleagues, all of them who are here. We have amazing people.
Amen.
So let's do this.
So we are at the end of our press conference, but what I would like to, just one more acknowledgement, I would like to acknowledge my state senator in my district in North Hartford, Senator Douglas McCory in the building.
Yeah!
stated, all this can be avoidable
Yes.
if there is just some common sense practices on how we deliver a budget that takes care of those who take care of our loved ones. And I just want that to be known, and I want that to be said. I know the work that you all do is very, very important. When we just celebrated my father's death yesterday, and while he was in hospice, I've had one of the most, careful nurses that made the difference
Yes.
in that transitional state for me. And it's only right. We're asking these nurses to not only be nurturers, but we're asking them to know we ask them to know everything that a doctor knows.
Yes.
And to be responsive and to do all that work, but yet not get paid for it. So let us do the right thing. Right now, we will open up this portion for questions from the press, or if there are no questions, we can get a benediction
I
going
think
on.
Representative Porter is the only legislator here who's a member of the Appropriations Committee. Is she still here? Oh, there you are. Can you tell us what the prospects are for maybe getting an additional, because these nursing homes are not going to settle until they know there's some form of increased reimbursement coming to them for Medicaid. Am I right? Isn't it? It's a chicken and egg thing, right?
And this is an issue that
And that's not going to happen by May 1.
Right, and this is an issue we face every year.
Yeah.
And it's been said, there's no money in the budget, but we know we have money to do what we feel we need to do. And I think this is definitely something that we need to do.
Yes.
And as the good pastor said, I come from a generation of women that have taken 15 cents and made $1.
Yes.
So I think that the government needs to do the same thing, and it can be done. It's just the political will to get it done, the backbone to get it done. So I'm calling on members of the Appropriation Committee to really take heed to what's been said in this room today, and to understand that you all don't get to take care of anyone unless you can properly take care of yourself. We have to take care of the ones that are doing the work. And this is just straight across the board, not just for the folks in this room, but for every worker in the state of Connecticut. This holds true. So I'm just hoping that, the members on Appropriations Committee will take to heart what's been shared and find a way, make a way, out of no way. That's what we're being told.
How far apart are the two sides? Somebody mentioned 4% in 2019, if I heard you right, and 4% in 2020. What is the other side offering? 4% is what you want, correct?
That's the request in terms of the state legislature for Medicaid funding increases. Right now, there's no money on the table. And so, the employers in many cases are asking for givebacks or are offering very, very modest increases, again, for workers who had no raise in 16, no raise in 17, and workers here who do not have a pension, workers here who are paying hundreds of dollars per month for family health insurance. And again, the vast majority of people in this room making between $13 and $15 an hour. And so at the moment, we do not have the ability to get contracts that allow people just to meet their basic needs as cost of living rises and their wages do not.
That's high school money.
Go out on strike May 1st if there is no.
Yes.
Strike will be on strike on May 1st.
Strike notices went out this weekend.
Strike notices went out on Saturday. So that's more than the 10 days notice that's legally required.
15 days.
Yes, we are. Ready? We've been talking and
Let's
talking.
hope that we get a
That's
sign.
right. That's right.
When is the next negotiating session? And are these
It
20?
depends upon
All
the
right.
It depends upon, the negotiating sessions depend upon the change.
Now, the 20 nursing homes, I think, are 4 or 5 different owners. Do they negotiate as a group?
Negotiate separately, except if there's a common owner.
Right.
Could I ask Representative Porter to come back for just a second?
Hey, Keith.
You asked about appropriations committee. I'm going to ask about the finance committee, because Governor Lamont didn't propose money for this in his budget. And even to get what he did propose, he wants to raise the sales tax, he wants to raise all the sin taxes. But you know, he doesn't want to raise the income tax on the wealthy. Is your party prepared, quite frankly, to challenge the governor on this rather than cut some other program to fund this? Couldn't you ask wealthy households to pay more? And are you really going to buck the governor on this?
Well, I can't speak for the finance committee because I don't sit on the finance committee, but I have always been one that stood for increased revenues. And when we talk about what's on the table, it's been said that everything is on the table, and you make the very valid point that everything is not on the table. Income tax is not on the table.
Do you think your colleagues that were ready, I mean, you've been pretty upfront about your position, but do you think a majority of your party is ready?
I can't say if a majority of the party is ready, but I do know other members that are ready.
Most of us in this room, by the way.
I don't want to speak for nobody.
It's not okay.
We have several people, several legislators that understand that you don't get to balance a checkbook without revenues. You can't write a check that you can't cash. All right? So we have to make sure that we're doing the things to build the revenue. And I think some of the things that Senator Kushner and I are doing around paid family medical leave and talking about increasing the minimum wage to $15, economic growth comes from wage growth. This stuff is so intersectional. It all goes together. You don't get to effectively do it without doing all of it. So I'm hoping that my party will come along and support everything that will be instrumental in getting this big thing done. Because you don't get the big thing done without all the little things.
Another question of the President of the Union. I think statewide the average on all the nursing homes in the whole state is like 75 or 80% Medicaid. What's the percentage of these 20? Is it higher?
It's consistent with that.
It is.
It's consistent with that, yeah. Perhaps even a little bit higher.
Yeah.
These homes are largely located in cities, which is where you tend to get a higher Medicaid population in nursing homes.
Rob, what type of trigger are you going to look for between now and May 1st where you say, okay, there's still progress being made, we don't have to actually strike, or, I mean, does everything have to be solved, or do you have to see a certain amount of forward progress? How do you measure what you do between now and then?
We'll have to see how things evolve, but there needs to be meaningful progress. Okay, there needs to be meaningful progress. In 2015, we were able to set a deadline, and the state legislature was able to come up with funding. We were able to avoid it. So we are absolutely hopeful that we can do that with the support of our friends. Look, our members love this governor. We worked hard to elect him. And we worked hard to elect the state representatives and senators that you see in this room. So we see this as people with common interests, hopefully coming together, so that we can make sure that workers in this sector get livable wages and residents in this sector get the care that they need. That is our absolute hope, and we know that we can get there. We just need to make sure that we get there based on folks being ready to fight.
No, you tell. Yeah, I bet you. She looks like someone that's got something good to say.
Any other questions?
Yeah, why can't she speak? Yeah, but it's, you're done now, aren't you?
Yes, we are.
Okay, why can't she speak?
Can we?
That's okay. Any other questions?
Can we get I can do it after actually.
Any other questions?
Yeah, could you just clarify again what is the local that you're president of?
SEIU District 1199 New England. Of this local, yes.
I'm sorry, what is the local number?
SEIU District 1199 New England.
I didn't know if it was a subset.
That's the local. All right, folks, thank you very much.